friends, this is Dr. Sameena Khalil here. I am a consultant cardiologist at the Heart Center, Lajpat Nagar. Today, I am here to talk about the latest updates in hypertension. As we all know, that hypertension has become a major issue worldwide, and nearly 40 to 50% of the population in India is probably suffering known or unknown from hypertension. So, according to the WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects as much as 45% of people in the age group of 40 to 60 years. Raised blood pressure is among the most common risk factors of cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness of hypertension, lack of appropriate care among primary care centers, and poor follow-ups. In India, the prevalence has remarkably gone up over the last 30 years to as much as 30 to 40% in women in India. Despite nearly half of the people, of as much as 50% of men and 41% of women with hypertension were unaware of this condition. Additionally, nearly 62% of men and 53% of women living with hypertension did not even get treatment or medication which were required at that time for their adequate care. The ACC-AHA guidelines has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension amongst patients with low cardiovascular risk. Among low-risk adults with stage 1 hypertension, management starts with non-pharmacological therapy. If the pressure remains to be uncontrolled at 3 to 6 months of the same, then consider starting on medical therapy. Lowering systolic blood pressure targets to between 110 to 130 mmHg systolic substantially was associated with a reduced cardiovascular event rate in step randomized trials and a very large randomized trial called the SPINT trial, which was done on Chinese population. It had assessed as much as 8,500 patients and had shown that intensive trimming of composite systolic pressures were associated with a 26% reduction in the composite cardiovascular risk. With regard to the prognostic value of different therapies, it was seen that most of the patients with hypertension require a lifelong medical therapy to achieve the optimal blood pressures. So in 2018, the European guidelines had recommended that the therapy should be started with a combination therapy of probably ACE inhibitors or ARBs with calcium channel blockers or diuretics, depending upon the patient profile. There is a huge discussion about what is the prognostic value of ambulatory blood pressure monitoring in patients of hypertension. So it has been seen that ambulatory blood pressure monitoring and nighttime blood pressure recordings have been recommended by the European guidelines for the diagnosis of hypertension. And it should not be only done in patients who are diagnosed case of hypertension, but also who have low risk but are newly diagnosed. It was seen that the 24-hour and a nighttime BP measurements were associated with greater risk of mortality and a composite higher risk of CV outcome. Thus, they should be considered and managed to decrease the cardiovascular risk in patients of blood pressure. For every 20 to 10 mmHg increment of BP at night, the risk of mortality increased by 23% and the risk of cardiovascular events increased by 36%. A large study called the HYGEA study was done to test the nighttime antihypertensive treatment. As we all know that there is a big discussion whether the treatment or the medications which we write should be given in the morning after breakfast or it should be given at night. So this trial was done to assess the same, and in this they had enrolled as much as 20,000 patients, and they were studied over an average follow-up of 6 years, and it was seen that the risk reduction for CV events was significantly improved for nighttime treatment when compared with awakening treatment. Just a short discussion about what is the importance of antihypertensive treatments in the current scenario where COVID suddenly has become a part of our lives. So it has been seen that acute respiratory distress syndrome is very commonly seen in patients with severe COVID-19. And a recent study which was published in JACC had shown that if metoprolol is added in these patients, it has shown a decreased incidence of lung inflammation and improves respiratory function in patients of COVID-19 induced ARDS, thus suggesting that probably ACE inhibitors or ARBs and beta blockers should definitely be one of the starting molecules for patients who come to us and present to us in the OPD with blood pressure, and not just monitoring blood pressure in the hospitals, but out of hospital monitoring of blood pressure is also very important to understand the risk reduction associated with the medical therapy we are writing for the patient. Thank you very much.